Welcome to the Living Diabetes podcast, where we dive deep into understanding diabetes straight from the experts. In this podcast, we will discuss the intricacies of type 1 and type 2 diabetes. So, whether you're newly diagnosed, a seasoned pro at managing your glucose levels, or just someone who loves a person with diabetes, this episode is for you. Let's start at the beginning. What is diabetes? Simply put, it's a condition that affects how your body turns food into energy. But there's more to the story, especially when we break down the two main types, type 1 and type 2. They're not just different numbers, they represent different journeys in the lives of those affected. So, what's type 1 diabetes? It's an autoimmune condition. The body's immune system attacks the pancreas, wiping out the insulin-producing cells. Low insulin means glucose stays in the bloodstream, and high blood sugar is a constant battle. Symptoms of type 1 can appear suddenly and can be severe, extreme thirst, hunger, fatigue, and blurred vision. If you or someone you know is experiencing these, it's time to talk to a doctor. Now, managing type 1 is like a dance, always in motion. It requires insulin therapy, either injections or a pump, and a close relationship with a healthcare team. It's about balancing insulin with diet and exercise and staying one step ahead of blood sugar levels. Let's shift gears and talk about type 2 diabetes. It's often linked to lifestyle factors like diet and physical inactivity, but genetics and environmental factors can't be ignored. In type 2, your body either resists the effects of insulin or doesn't produce enough. Symptoms might be more subtle and develop over years: increased thirst and urination, increased hunger, and fatigue. Management strategies here are also about balance but focus more on lifestyle changes. A nutritious diet and regular exercise can do wonders, and sometimes medications are necessary to help the body's insulin work better. What's crucial to understand is the differences between type 1 and type 2. They may share a name, but their management is unique, just like the individuals living with them. For example, while insulin therapy is a must in type 1, it's not always the case in type 2. And while lifestyle changes are beneficial for both, they can potentially reverse type 2, which isn't the case for type 1. Now, living with either type of diabetes isn't just about the physical aspects, it's about finding a rhythm in life that works for you. Daily routines, meal planning, staying active, and regular monitoring, all done with the underlying beat of self-care and support. To all our listeners out there managing diabetes, remember this: you're not just dealing with a condition, you're mastering the art of balance. It's about managing meals, movement, and medication. It's about tuning into your body's needs and harmonizing with your health goals. And if you're supporting someone with diabetes, know that your role is invaluable. From sharing in the responsibilities to simply being there, your support can make all the difference in the world. As we wrap up today's episode, I want to leave you with a message of empowerment. Whether you have type 1 or type 2 diabetes, there's a wealth of knowledge, resources, and community out there. You can live a full, active life with diabetes, and we're here to help guide you every step of the way. For more detailed information, tips, and support, be sure to visit our blog linked in the episode description. And don't forget to subscribe to Living Diabetes for more conversations that matter to you. Thank you for tuning in, and remember, balance is not something you find, it's something you create. Until next time, stay balanced and stay healthy.